Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Neuropathic disorders. So, under the neuropathic disorders, let's look at the hereditary neuropathic disorders. So, first we look at the hereditary neuropathic disorders. So, hereditary neuropathic disorders, it includes the Charcot-Marie-Tooth disease. So, there's presence of Charcot. There's Charcot-Marie-Tooth. This Charcot-Marie-Tooth disease. So, Charcot-Marie-Tooth disease is involved, and this is the most common hereditary neuropathy. So, this is MC, hereditary neuropathic dystrophy. It is the most common hereditary neuropathy. Next is we look at the Tangiers disease. So, there is Tangiers disease. So, Tangiers disease, and then comes the Friedreich ataxia. This Friedreich ataxia. Friedreich ataxia, Tangiers disease, and Friedreich ataxia. And then there's also the familial adenomatous polyposis. So there's familial adenomatous polyneuropathy. Then we look at the HNPP. So what is meant by HNPP? So here when you look at HNPP it stands for the hereditary neuropathy with liability to the pressure palsies. So it is a hereditary neuropathy, and this is with the liability. So hereditary neuropathy along with the liability to the pressure palsies, pressure palsies. Next is we move on to the hereditary neuralgic amyotrophy. So there is the HNA. HNA here it stands for the hereditary. So HNA stands for the hereditary neuralgic. So this hereditary neuralgic amyotrophy. Next is the neuropathic disorders and hereditary. So there is a hereditary sensory. There is hereditary sensory and also the autonomic. Hereditary sensory as well as the autonomic. There is autonomic neuropathy. So it is known as the HSAN. Next is the hereditary neuropathy. It includes the Fabry's disease. So there is Fabry's disease, and Fabry's disease it includes the angiokeratoma corporis diffusum. So angiokeratoma corporis diffusum. Then comes the presence of the Refsum's disease. There is also the involvement of the Refsum's disease. Now let's look at the causes of the acquired neuropathies. So what is the cause of the acquired neuropathies? Cause of the acquired neuropathies. So in terms of acquired neuropathies, it includes the primary and the AL amyloidosis. So it includes the primary as well as the AL amyloidosis. Next is presence of DN. DN stands for the diabetic neuropathy, and then there is involvement of the hypothyroidism. So DN diabetic neuropathy, then there is involvement of the hypothyroidism. So there is DN, then hypothyroidism, then comes the Sjogren syndrome. There is Sjogren syndrome. Then comes the presence of RA, that is a rheumatic arthritis. Then the scleroderma. So the scleroderma as well as the sarcoidosis. Then is the infections. So what is the infections which are involved? So infections involved, it includes the VCZ. There is the VCZ, CMW, and then the EBV, then HIV, diphtheria as well as the leprosy. Now, what are the other causes of the acquired neuropathies? There is presence of the IBD. IBD stands for the inflammatory bowel diseases. The presence of IBD, inflammatory bowel diseases, as well as the CIP. CIP stands for the critical illness polyneuropathy. So the critical illness polyneuropathy. To learn and grow daily like this, please do subscribe.